Thank you, Mr. Chairman, for calling this hearing, and thank you for all of our witnesses for being here. Today I just left the Ways and Means Health Subcommittee, who's holding a hearing on a very similar topic. And a physician from Wichita was one of the witnesses, so I'm keenly aware of the bureaucratic red tape, the lower reimbursement rates, the rising prices, and the impact that they have on independent physician practices, and that we're seeing private practices close or consolidate as a result. As I've spoken with patients and providers and physicians and support staff throughout Kansas, consolidating or closing practices is not helping Kansans receive quality health care. With fewer and fewer doctors and nurses in private practice, patients are seeing increased costs and worse outcomes. The Kellogg School of Management notes that prices increase about 14% when a private practice is acquired by a hospital. And the National Opinion Research Center survey found that 45% of physicians report deteriorating patient-provider relationships after consolidation. Increased costs and diminished outcomes are not the recipe for a healthy society. Dr. Brugman, in recent years, we've seen a significant decline in the number of independent physician practices and an increase in the number of practices owned by hospitals and health systems. Based on your experience as a practicing orthopedic surgeon, what incentives do you see in the marketplace for physicians to sell their practices to hospitals and health systems?
Yeah, I think it's two things. It's economics and getting back to taking care of patients. The economics are not in our favor in private practice, and they're in our favor in a guaranteed salary that someone else is responsible for. And then we are trying to spend more time taking care of patients. And by selling your practice, you offload that regulatory burden to another entity who now takes it on for you. And so physicians are theoretically able to spend more time taking care of patients, and that's why they are giving up control of their practice.
Yeah. You noted in your testimony that the cost for procedures commonly conducted in your practice would increase approximately 30% in concentrated markets compared to more competitive ones. What causes prices for healthcare services in consolidated markets to be higher?
It's the bargaining power that those consolidated groups have. They're able to ensure higher payments because they're in a larger group.
And those are some of the issues I think that several of my colleagues have talked about today in terms of the impact, and as my friend from Texas just went through a whole litany of some of the concerns over the last few years. Again, based on your experience as an independent physician, what consequences are there for patients, the local community, federal and state budgets when independent practices are acquired and the cost of healthcare goes up?
In my community, we had a group that decided to sell to the local healthcare system. One of our largest employers is the grocery store. So what that's going to mean for every single person in my community is higher grocery prices because those costs are ultimately going to have to be passed along to our community. And so it's an access issue where people have a harder time getting their doctors. They're not able to get primary care physicians. And then it becomes a cost issue where we have to pay more for goods, not just for healthcare, but for goods in general as these consolidations occur.
Yeah. Well, I just want to thank all of you panelists for being here. Obviously, this is an issue that's of paramount importance for our country. I mean, because it doesn't just affect individuals, but it affects, as we talk about from the Budget Committee side, the concern about our debt and deficit for the country. And obviously, we want a vital, vibrant healthcare system to support all Americans in their healthcare needs. But we also need to make sure that it's affordable and that the processes work. And Mr. Chairman, I really appreciate this process. I think I appreciate having the witnesses together, and I want to make sure that, as so many of my fellow Kansans are being crushed with inflation the way it's going now, particularly with the economy and some of the regulatory burdens that have been imposed in the last few years. And we just can't afford to have this continuing increase in prices. I'll yield back.